everyone, this is Abby from nursing.com. In this video, I'm going to show you how to use your nursing knowledge and to apply it to a matrix multiple choice question. This is an item type that you'll see on Next Generation NCLEX and on item types at nursing.com. It's these tips and tricks that are going to show you how to apply your nursing knowledge. There might be some learning opportunities too. Let's take a look. You'll know it's a matrix multiple choice question because it's in a matrix and you have multiple choices to make on each row. A matrix is built with columns that run vertically and rows that run horizontally. On each row, the horizontal piece, you'll be able to make one choice. There will be multiple for you to pick out of, but one choice is going to be correct on each line or row. You're going to look for some words that indicate that you can only pick one. It might say something even like pick one on this row, right? Or it could even say, is this appropriate or not appropriate? Sometimes there will be two choices, sometimes there might be more choices, but it's one per row. You'll also know that it's a multiple choice question on a matrix with the radio buttons. They kind of look like this on a Scantron sheet, and I know you've seen these in multiple choice questions before, so you'll recognize it. Now, I'll show you how to apply your nursing knowledge. Let's go to a real question at nursing.com. Here's our question. Now, can you see what I was talking about? Here are the rows that run horizontally and the columns that run vertically. And look at these radio buttons. I can't even try to select both if I want to. So this is a multiple choice as opposed to a multiple response. So I'm going to pick one or the other. Let's read our question before making any selections. The nurse is providing education to the client about the plan of care following postpartum hemorrhage. For each of the following client education topics, click to specify whether the education is appropriate or not appropriate to include. There's that word I told you to watch for. We've got one of two choices for this particular question, whether or not this client education here in this column is appropriate or not appropriate. Let's treat each row like its own question. So you could even take a piece of paper and cover up the other pieces as you work through each one in turn. Now, another thing that you have available to you on Next Generation NCLEX item types is the EHR. Go ahead and click through the EHR when you're answering any of these questions to see if there are any indications from what the question is asking to find clues in the EHR. So there's going to be nurse's notes, history and physical, lab notes, orders and flow sheets, so on and so forth. Let's take a look at each of these education topics. So this first one says, the risk of postpartum hemorrhage is over at 24 hours after delivery. Is that appropriate education? This is pretty absolute. I look for this on questions as well. Is over. There's no more possibility of postpartum hemorrhage. That's not appropriate education. It's not true. The risk for postpartum hemorrhage is not over at 24 hours. So this is inappropriate education. Also, let's take a look at the next one. Oxytocin may be continued for the next few hours. Appropriate or not appropriate? You know, this is appropriate. We don't know how long the oxytocin may be continued, but it may be continued for the next few hours. Also, going through the EHR will give us some more information about the condition of the uterus, whether it lacks tone and needs some help from oxytocin for contraction or fundal massage, etc. This is appropriate education because oxytocin may be continued to help in this case of postpartum hemorrhage. The next one says, report to the nurse or provider if the peri-pad is saturated in if the peri-pad is saturated in 1 hour or less. Now, I love this question. I know we just talked about how no use of absolutes, but this is really appropriate. This is telling the patient when to report to the nurse and when is specifically what to look for if the peri-pad is saturated in 1 hour or less. We know that if it's saturated in that time frame from what we know about postpartum hemorrhage, that is really too fast and could be an indication of more hemorrhaging. So that's appropriate education. The next one says the client will be transferred to the ICU for observation. Well, we can peek through the chart and take a look at things, especially like the laboratory notes. We can see, if they're bleeding to the point that they need ICU care, that really high level of care, or we can tell from the flow sheets with their vital signs about the patient's stability. Now let's read that again. The client will be transferred to the ICU for observation. Well, we don't know that yet. We don't even have an order for this patient to be transferred, and the vital signs tell us that this patient is stable, so she doesn't need a higher level of care at this point. She can stay on the postpartum unit. So this is inappropriate education or not appropriate. We don't know if they will be transferred. And then lastly, do not breastfeed for at least 24 hours. What do we know about breastfeeding? For one, it's really, really healthy. It's really good for baby. Tons of nutrients, lots of antibodies, tons and tons of great reasons to breastfeed. Now, it is a choice, so if mom is choosing not to, that's another thing. But this is another case of do not breastfeed. That's pretty absolute. Plus, we're dealing with postpartum. And what is postpartum hemorrhage due to? A lot of times the fundus or the uterus is not actually taut enough, it's boggy, and so it's just bleeding like crazy. Breastfeeding helps to increase uterine contractions, therefore helping with tone of the uterus and to mitigate the possibility of postpartum hemorrhage. This is really inappropriate education for this client, so we'll go ahead and click not appropriate. Once you've made your choices and you've treated each row as its own specific question and as it applies to the scenario of the patient and the question, you can go ahead and click submit and take a look at the rationales. Here we were right on all of the questions, so that's great. That feels good. But what's important on any question is to go ahead and take a look at the rationale and pick out the ones that you answered incorrectly for an opportunity for learning and remediation, and make sure to pay close attention as well to the ones that you answered correctly so that you can reinforce your learning. Great job, everybody. You did a great job. To wrap up, let's take a look at these linchpins. You'll know that you have a matrix multiple choice question because it appears on a matrix of horizontal rows and vertical columns. On each row, there are multiple choices, but only one correct one per row. What helped us in this question was to weed out the inappropriate education choices because they contained either absolute words or incorrect information. Remember the part about do not breastfeed for 24 hours? That just isn't correct. We showed clinical judgment because we know that patient education is essential and it should be accurate. We want to make sure that our patient, and in this case, their infant, has the best and most safe care possible. Now, you did great, and I know that you've got some more learning to do, and that's what we love here at nursing.com, enhancing learning. Go out, be your best self today, and as always, happy nursing.